Welcome to the Bossed Up Podcast, episode 460. I'm your host, Emily Aries, the founder and CEO of Bossed Up. And when I saw that Emily Oster was out with a brand new book, as a former guest on this very podcast, back when I was doing my motherhood and work series leading up to my son Max's birth back in 2021, I immediately reached out to her and said, we've got to get you back on the podcast. This is such an interesting take for a second book, a sequel really to her first hit, Expecting Better. And she very kindly deferred and said, no, I'm too busy. To which I replied, well, how about your co-author? Because unlike her previous books, Emily Oster, the economist, co-authored this book with a maternal fetal medicine specialist, Dr. Nathan Fox, who brought a very interesting lens to the medical risk calculations involved with being someone who is navigating a complicated pregnancy. And just about a year ago, I had just done an episode with Sarah Braffman, a policymaker, on the new Pregnant Workers Fairness Act, new workplace rights for pregnant workers, that I thought this episode absolutely needed to happen because my first entire series on motherhood at work was shared and recorded from the very naive but adorable position of being someone who was going through a very simple pregnancy. As many of you know, I've been very candid with you as listeners over the past year. I've been navigating recurrent miscarriages that I've talked about and kind of processed in a variety of ways on this very podcast. One episode that comes to mind in particular was with Dr. Alice Domar, whose research studied the impact of stress reduction on infertility. And so I feel like this is a journey we've been on together. And I have some exciting and good news that we'll get into in this interview because things here are looking up, which is my way of saying this book on navigating pregnancy during or after complications is particularly relevant for me right now. And joining me to break that topic down is the expert, the co-author, the maternal fetal medicine specialist himself, who already partnered with one amazing Emily on this amazing book with Emily Oster. And now he's here with me, another Emily, to talk through how to navigate pregnancy complications and advocate for yourself, both when it comes to your medical team and in navigating this in your workplace. Dr. Nathan Fox is an obstetrician and maternal fetal medicine specialist practicing in New York City. He's also the host of the Healthful Woman podcast and recently co-authored a book with Emily Oster called The Unexpected, all about navigating pregnancy during and after complications. I am so excited to have you on, Dr. Nathan Fox. Welcome to the Bossed Up podcast.
Thank you for having me. It's a pleasure to be here. Nice to meet you.
I'm so delighted to be chatting with you on so many fronts. I'm holding in my hands right now The Unexpected, Navigating Pregnancy During and After Complications. Congratulations again on this feat. I'm now currently navigating a pregnancy that has not been so simple. This is news to my listeners too, but I am 23 weeks pregnant as of this week. And last year, I was really candid with folks on this podcast about losing two babies, right? Two miscarriages in the first trimester, possibly three, actually, now that I go back and collect all the data. And so it's like a personal and professional interest of me to have you, a maternal fetal medicine specialist, a podcaster, and now a co-author on this podcast to really talk about what I know so many women listening have navigated or are navigating or might navigate. So my first question for you is just what inspired this book that even in the opening pages you write, I hope no one has to read. So why write this book?
Yeah, first of all, that is the big reveal about your pregnancy. You look terrific. I hope you're feeling well.
Thank you. I'm feeling great.
Good. My career is not writing books, right? I'm a doctor. I see patients. That's what I do. And I started a podcast, right, a few years ago, which is mostly just sort of for sport. It was something I thought was cool. I started listening to podcasts and I'm like, I don't think there's any really good podcasts for pregnancy and women's health because either they're sort of run by lay people, which is great, so they're more interesting and they're talented, but they're not really deep. They're not really the information one needs, or they're run by doctors, which are horrifically boring. So I felt there was space to do that. So I had this podcast and it's going well. And who am I going to have as my first guest on the podcast? And I had over the years developed a close relationship with Emily Oster, mostly just because I read her first book and I loved it. Thought this is really cool. Like she's an economist and she wrote this book on pregnancy and like it's so strange, but she did such a great job and the book is amazing. And the one I recommend to patients, I literally like cold called her. I just reached out to her and said, "Hey, I'm a doctor in New York, and I like your book, and thanks for doing it. And if you're ever in New York, let's have lunch." And so she answered, and she's really delightful, and we met, and then we started collaborating. And so I called her. I said, "Hey, would you come onto my podcast?" And again, she graciously said yes, and we've been sort of collaborating for a few years, sort of, like unofficially collaborating. She would email me when she got questions from listeners that needed help with, and I would sort of, have her on my podcast. And then she said, I'm thinking of writing, I guess, a sequel to, Expecting Better related to complicated pregnancies. And she said, this isn't really my wheelhouse. I need to partner with an OB or an MFM. Would you do it? And I'm the kind of guy who just says yes. I'm like, "Yeah, great. Like, let's do it." And again, listen, I just that's just sort of how I live my life. I think adventures are great, and I think trying new things is great. And occasionally you fall on your face, but it's what life is about. Carpe diem. I'm a big like just seize the day, do what you can. So I said, let's do it. And we spent about a year back and forth writing and collaborating, and which is amazing. It was a great process and I'm really proud of what we turned out. It's really, I think, if I say so myself, it's a good book, but I think it's really meant to be very helpful to a lot of people. And yes, you would hope that no one needs to read this book because it's about what to do in a pregnancy after your first one went awry in some way or another. But that's naive because so many people have complications in pregnancy ranging from, you know, what someone might call small, which doesn't, what does that mean, a small complication, to something like life altering, devastating, and everything in between. And what do you do the next time around? And how do you navigate that? And so I think this hopefully will be very helpful to a lot of people, which is really that's the part that's meaningful to me.
Yeah, absolutely. I just love the idea. It almost sounds like the setup of a joke that like an economist and an MFM walk into a bar and you're like, that is the bar I'd like to hang out in. Because I, for full disclosure, love Emily Oster because I studied at Brown University as an undergrad. I studied political science. We never overlapped there, but when I found out that this economist was becoming quite notorious for her work in like prenatal care, I was like, yes, that is the decision-making power I really think that I crave as a pregnant person, as a woman, that I think so many people listening want to have as well, which is one of the things I loved most about this approach that you've taken in the book is how can we partner with our experts, our medical care team, who know a lot more about medical risk and, choice in that regard, without losing our sense of agency over our own bodies and our own choices, right?
100%.
And so I was really fascinated by your philosophy around like joint decision making. And we could get into a million different examples because your book goes like chapter by chapter on many very different kinds of complications. But overall, tell me about that philosophy of how someone who is navigating a complex pregnancy or even thinking about giving it another shot after the first one or last few did not go well, like how do you partner with a care team without saying, I'm going to make all the decisions or succumbing to 100% of them making all the decisions?
Right. So there's a lot to unpack there. The first is I don't know which one of us is going to comment on the fact that the person from Colorado said joint in decision making. That's fine. Okay. Haha. All right. No. So seriously, though, I think that there is this concept in medicine now, either called joint decision making or shared decision making. And the idea is that historically in medicine, doctors were it was a paternalistic field, meaning someone would come to a doctor like, "I'm a patient, I'm in trouble, I have a question, you're the expert, you tell me what to do." And that was sort of the relationship. The doctors, is the expert and, the high and mighty, and we would and not necessarily a bad way, but like, "All right, here's what you should do." And people would just say like, "All right, like, that's what I'm gonna do." And then there was this pushback against that, appropriately, that, it's not all about someone telling you what to do, but helping you make a choice what to do. Because sometimes, like if you're having a heart attack, we don't say like, "Hey, would you like CPR?" Like that's not the situation, but it's there's a lot of things in medicine that are not clear cut. They're not, cut and dry, that there's options or there's risks and benefits to each way. And the idea was to shift it from a paternalistic view to some people call it patient centered. Some people used autonomy, like the idea that the patient, the person who's sitting there, has agency over their own body and own decisions, and they're gonna make decisions. Great, like that's an amazing concept. And so medical training and medical sort of philosophy changed to we're gonna try to shift it that we are there to guide and to help and make recommendations, but ultimately the patient chooses. Now, it's a delightful concept, but the problem is it frequently breaks down. And it breaks down on both ends, meaning frequently the doctor might feel like, what is going on here? Like, why does this person think that they know better than I do? I went to medical school, I trained, this is my expertise. Like, and that you hear things like, would you tell your plumber how to do things? Would you tell your electrician? And so there's frustration sometimes on the doctor side, the provider side of this relationship isn't working because this person is telling me how to do my job. And on the other side, the patients sometimes get very frustrated because either they feel the doctor is still being too paternalistic, or they feel, why is the doctor asking me what I want to do? I don't know what to do. I'm here to ask you what to do. And so it often breaks down into frustration. And I think the reason is, and this is the long answer to your question, I think the reason is the approach to shared decision making is not that everybody comes in as equal partners and you whiteboard it and make a decision. It's the doctor, it doesn't have to be a doctor, it could be obviously a nurse practitioner, whoever, the provider, the doctor comes to the table with a certain expertise and experience about medicine. And then the patient, the person on the other end of the table comes with certain expertise about themselves. What are their values? What are their fears? What is it they're looking for? What are their goals? What are their experiences?
And also like risk tolerance, right?
Everything, all this stuff. And I tell people this all the time. I said, you know yourself better than I know you. And so we need to sort out what to do. But like, are you the type of person who would rather, you know, try something more experimental, knowing that there might be some risk? Or are you the type of person who's a little bit more conservative and would rather just do tried and true, even if it may not necessarily work? And these are things that, again, that's how shared decision making is supposed to work. Or I say, listen, there's two options. There's A, there's B. I think they're both reasonable. Here's the upside to A, the upside to B, the downside to A, the downside to B. What do you feel about that? Like going back to the plumber example, if my plumber said to me, what kind of pipes would you like me to use for your toilet? I'd be like, I don't know. Like, what are the options? I have no idea what you're talking about. But if he or she said to me, all right, listen, we can use this kind of pipe, which is going to last longer, but it's twice as expensive. Whereas this one, which is going to save you some money, but you may have to replace them in 5 years. All right, I can make a decision. Do I have cash up front? Do I want to wait am I moving in 3 years and I'll leave it for the next person? I know that about me. And so that's shared decision making. And we're trying to bring that to medicine and also giving the patients the background knowledge to have that conversation without feeling left out, not understanding what's happening.
Absolutely. And it feels to me like society writ large gives pregnant people a lot of unsolicited advice that's very black and white, right?
Oh,
It's just
yes.
like you shouldn't do this, you have to stop doing that, you have to do this and you have to do that. And it's just what I loved about Expecting Better was Emily's approach to looking at the data. Like how confident are we in any of this advice? And unfortunately, it's not perfect. Oftentimes, like we don't have huge data sets and some things like complex pregnancies are really hard to study. You can't do a double blind study on some of these things. And so, kind of knowing that you have a care team who you respect, but also who you feel respected by in helping you to make those decisions for yourself is so key and also kind of hard to figure out. So, what advice would you have for folks who are wondering, like, how do I go about preparing? In the book, you say preparing myself, preparing my materials, and preparing my script to figure out, do I have that care team?
Yeah, that's the golden question, and I think that I mean, I'm a doctor. My father's a doctor, my brother's a doctor, my wife's father was a doctor. Like, I'm around doctors all the time, and when I go to a doctor, I have that same question. How do you know if this person is any good or if they're right for me? It is very, very hard to know this. So, like, for everyone out here who's like, God, I have no idea. You are like everybody else. It's very hard to know because what could you possibly glean? Like, all right, you're going to know if their office is clean. You're going to know if the person who greets you on the phone at the front desk is smiles at you. You're going to know if they run on time. You can take a glance at the diplomas on the wall, like, ooh, she went to Brown. She's smart. Like, you can get a little bit of that. You can get a little bit of that. But ultimately, it's nice to have all those things, but it's not what you care about. You want to know, is this person going to take care of me? Is this person going to help me? And I think some of it depends on the context of what you're looking for. So, for example, if I have something in my body that needs to be surgically removed, right? You don't need a long term relationship with that person. You're like, I want to find the person who has the best hands, who is the best surgeon, who's going to open me up, take this out, and close me up in the fastest way possible that won't kill me, right? And I'll recover quickly. And whether that person is kind to me and listens to me, it's nice, but ultimately, you'd much rather have a very, very competent surgeon who's a jerk than a really, really lousy surgeon who's delightful, right? Because your goal is not to have this person care for you for 50 years. It's literally like one and done. Take out my appendix and I'll never see you again the rest of my life. And so, in a situation like that, you're like, okay, what do I need to look for? I want to look for experience. I want to look for training. I want to look for if there are new ways to do the procedure that are less invasive. Are they skilled in that? Are they not skilled in that? Things like that, much more so than, oh, this doctor wasn't nice to me or their office was annoying, because you'll never need to see their office again. On the other side, if you just got diagnosed with diabetes and you're 22 years old, this person's going to be in your life until one of you drops dead, right? I mean, you're talking for 50 years, right? You're talking about. And so that person, probably you're going to have to say, all right, listen, I assume that this person went to medical school. They're probably bright, right? And diabetes is not such an uncommon diagnosis. They probably know something about diabetes. What do I care about? This person needs to be a good listener. They need to be available. They need to be someone I get an appointment with. They need to be someone who I can talk to, who I trust, who I think values what's going on in my life. And that's much more important than the degree on the wall. And so I think a lot of it is it's different based on what your goal is going into it.
And pregnancy is like in between, right? Yeah.
Yeah, yeah. So I would say it's much more the latter than the former, because in pregnancy, even though it is a limited relationship, it's a year. And for many people, it's multiple times. You have one kid, you have two kids, you have three kids, you have four kids. Each time it's that. And frequently they're going to end up being your gynecologist afterwards. So if you're like a typical, in terms of like healthy, no big issues in your life, and you're looking for an OBGYN, you're looking much more so for the relationship aspect. Because also things come up in pregnancy, things that are very emotional, things that are very private, things that are very personal and potentially hurtful. And it matters. The stakes are very high if the person can't have a good relationship with you. Again, in a very high risk pregnancy, and it might be less so. It might be, listen, I've got a real straight, like a very significant one-time problem right now with this baby, with this pregnancy. Maybe it's much more so the expertise. And again, you'd love to have both, but you have to sort of think about that in terms of what you're looking for. And then how do you evaluate that is then the next thing. How do you assess if someone is a good person, is a good listener? And I would say word of mouth from people is helpful. I Online reviews are pretty much useless because they're always the people who love you the most or hate you the most.
Yeah, I've never thought about reviewing my doctor online ever, so I can imagine.
Exactly, but if you know someone or can talk to someone who went and ask questions like, does he or she listen? Like, does he or she value your opinion? Does he or she talk to you like a human being? Right? And these are things if you can't figure out, meet with them once. It's no different from dating. You sit across a table from someone, you talk to them for 10 minutes, you get a pretty good feel what they're like personality wise. And is it a good match for me? And different people want different things. Some people want funny, some people want intellectual, some people want quiet, some people want loud. You have to sort of see what you want to see if that person's a good match for you.
Yeah, and how they make you feel, right? Like, just, like, that self-reflection afterwards. It's so interesting as I was going through multiple miscarriages, I'm such a data hungry person. I'm like, "Give me all the information I can get," and after the first loss, everyone said, "There's not much to be found out here," which is reinforced in your book, right? Which because these are so common. Basically, it's probably a genetic abnormality. It's your body basically saying this pregnancy is not going to be viable anyway. Move on, right? And
We don't say it quite like that, but yeah.
yeah, nobody said it quite like that to me, but that's how I felt. I was like, dang, okay, there's nothing to be done here. I'm such a fixer and a doer and a logic oriented, like evidence based person. I was like, what can I do? And just the surrender involved in pregnancy has been so humbling. It was already humbling last time around, but this time around especially. And so the second time it happened, I said, all right, this. I'm getting as many opinions as I can. I want as much information as I can. And it was funny reading your chapter on miscarriage where you described sort of like the frustrating senselessness of it all, oftentimes, because that's exactly how I felt, which was there was nothing to see here. I got all the blood work I could get done. I consulted with an MFM beyond my midwife practice. I found myself an OB, a proper OBGYN, and like I just made appointments basically and talked it out with as many providers as I could. I saw a nutritionist, I got hormone testing, and there was nothing to be found, which is good news, but also very frustrating.
But that's the right thing to do because you have this inner, it's like a void. You're trying to figure out what the hell happened to me and you're seeking answers. And those are good places to go. It's not like you went, into some like, wacko things to figure it out. You're doing the right things. And I frequently tell people that, with especially with the miscarriage, it's very nihilistic in a sense. Like we have no control almost always over this process. And some people find that very disconcerting to feel like, wait, I don't have control over this. Like I can't make this pregnancy better. I can't make it worse. It is what it is. And we're going to just have to wait and see how it finds out. Other people find that very comforting. Other people say, oh, well, it is what it is. And it'll play out the way it plays out. And if something good happens, that's great. And something bad happens, at least I know it's not my fault. And it's amazing that I say the same thing to two different people. One person is like, that is the worst news I've ever heard. And the other one's like, wow, I'm so happy that it's not in my control. And humans are different across the board, which is fascinating.
That's such a good point.
But it's true. There are situations when miscarriages are due to underlying reasons that can be identified and can be addressed. That happens. And so absolutely you have to go through the due diligence, but it's really the exception, not the rule, unfortunately.
Right. Yeah. And what I loved about the book is that you go chapter by chapter talking about risk of recurrence so that when you're even thinking about trying again, which takes some time to kind of wrap your head around, depending on what you've been through. I have a girlfriend who went through some significant birth trauma who's like, I'm going to need a minute before I can even like conceptualize having another child that I want, but I have some trauma to resolve, you know? And it's like, knowing the risk of recurrence, because some things have nothing to do with future pregnancies and some things predict what will happen in future pregnancies, just breaks it down in such an empowering way in the book. I will confess, I got to the chapter that said, and I'm newly in my second trimester, that was like second and third trimester complications. And I'm reading this in bed and I turn to my husband, I show him the chapter title and I'm like, do you think I should be reading this right now? And he was like, absolutely not. And I was like, me neither. I'm going to just skip to the end here. So I'm going to read the middle part of your book only if and when I have to, because I'm living through it right now. And I run a little anxious, but then I skipped to the end and read the last couple chapters. And it's just like, I had some breastfeeding challenges also with my first that I was reading about and we were talking about last night, and talking about recurrence, and like, this is probably going to happen again in some capacity. It could happen again. What would we do differently? Kind of having that discussion up front is so empowering. It's giving the information that patients need to really make those best choices for themselves in a very uncertain process.
Yeah, and what's interesting, and I agree with everything you said, and I agree that having an understanding of what to expect, expectations have a lot to do with sort of the experience. If the experience matches expectations, it tends to be a more positive experience or a less traumatic experience, even if it's not a positive experience, than if it doesn't match expectations. So understanding what your risk is, what can be done to mitigate that risk, what can't be done to mitigate that risk, sort of putting it in context is very, very helpful for people. I agree that it's not always helpful to read about all the terrible things that could happen to you. But you know what's really interesting? The other group of people for whom it's really helpful is not just the person who went through it or is about to go through it again, but for their family and friends to understand, oh, oh, now I understand, like, what she means when she said, "I had this, and I this, and I this," and I get a better sense of what that means and what she's going through, so you can really like, for people who've gone through, let's say, like, some complication, say, like, "Please read this," like, "Mom, dad, friends, read this and then talk to me."
I mean, when I read the chapter on hyperemesis gravidarum, whatever it's called, basically like extreme throwing up, and hearing the women's stories who were so dismissed, saying it's just morning sickness, what's the problem? And hearing how life altering that is. And like, I cannot imagine the courage of going back into pregnancy for a round two on that one if your likelihood of it happening again is so high. And actually brings me to one of my final questions I wanted to ask you, which brings this back to the workplace context, which is this February, actually, before I knew I was pregnant, I accepted a full-time job in-house for the first time in 11 years. I'm now an employee in addition to what I do at Bossed Up. And the last pregnancy and all the miscarriages happened when I was my own boss. Now I'm navigating early pregnancy, after loss in a workplace with a boss. And it just makes me empathize so much more with most of my listeners who are full-time working women. It's like, if you have some of this stuff come up, I feel like the workplace has barely wrapped its head around parental leave as a concept, which is still not a right for everyone in this country, right? But it's like, how do your patients navigate not only the conversations with their family members and their providers, but with their workplace? Because I'll tell you what, I didn't disclose this pregnancy for a long time because I was holding my breath and basically riddled with anxiety, wondering if it was going to last. And so I'm just like wondering if you have any thoughts or advice or experiences on that front, because navigating complex pregnancies in the workplace feels like especially daunting.
Yeah, it's very, very challenging. I think it's obviously very challenging for pregnant women going through complicated or uncomplicated pregnancies. Also because you don't always even have a diagnosis. Like, what if someone like they had a very traumatic pregnancy the first time around and now they're in their second pregnancy and it's going fine, but they have expected anxiety. So they have many, many visits and this, and how do you even explain that to someone? Number one, that's number one. Number two, there's so much like privacy. You don't want everyone knowing your business, obviously. And I would say it's very common because many people get pregnant, obviously, and now everyone's working, right? So it's I mean, everyone's working. So it's very, very common. And it's also challenging for people who with, let's say, chronic medical conditions. They have cancer, they have diabetes, but the difference is if you go to someone in your workplace and you say, I've got cancer, they'll be like, oh my God, go see the doctor, get like, oh, yeah, whatever you need, whatever you need, whatever you need. But the problem is that you say, I'm pregnant, like you said before with the hyperemesis, all they know about pregnancy is either their own experience, their spouse, their family member. They're like, well, pregnancy is not a big deal. Like, why would you need to be at the doctor more than once a month for 15 minutes? Like, suck it up. But that's not what it's like for a lot of people. Some people's pregnancies are a disaster, and I'm seeing them twice a week for an hour, and it's so hard to sort of do that. What I would say though is most places of work that have proper HR departments, so middle to bigger size companies, they get it. You could go to the HR person and just tell them, I have a pregnancy, I got this, I got this, I got this. They're going to tell you, here are the rules, here are your benefits, here's what you get paid for, here's what you don't get paid for. We can't fire you. Like, and it's very, very ordered. Again, whether the laws about how much you get paid for, what you don't get paid for, it differs based on the job, based on this, but you're not getting fired. They can't fire you. Like, and they'll get it. I would say the hardest time people have is not with that. It's either with just people who work on a team, their team members being respectful of them and understanding what's going on, or people who work in much smaller environments with don't have HR, they just have a boss or they have some person that they work for. And then it's just, it's total randomness how helpful or open they're going to be to that. So I think that is notoriously challenging. It's very, very difficult.
And I'll link to some former episodes we did about workplace rights. The Pregnant Workers Fairness Act, which just went into law last summer, gives women the right to reasonable accommodations during pregnancy that wasn't actually afforded across the board historically. And so I think there's so much patient advocacy required in pregnancy. There's also workplace advocacy required in pregnancy. And while you're already multitasking all the time while you're constructing a human with your own body, it's just a lot. So I think, however we can make this easier for women and empathize and not assume what someone's pregnancy experience is like is just so, so key. This has been such a joyful conversation. I could talk to you forever. There's so much more to your book than we even had time to get into and your podcast. But let's leave our listeners with knowing where they can catch up with you and keep tabs on you and tune into your Healthful Woman podcast. So tell us, where can we learn more and where can we get our hands on this book?
Well, if they're walking around the Upper East Side of Manhattan and see me, they can come and say hello to me and we'll take a selfie. So that's number one. In terms of my practice, our practice is in New York City on 90th and Madison. And, we're at Mount Sinai Hospital in New York City. If you're not local and you want to hear from me otherwise, or if you are local and you do, so I do have this podcast. It's called Healthful Woman. It's very hard to say that podcast name. It's a terrible name. We should have called it like something else.
Same thing with Bossed Up. Everyone just hears boss and up. So I feel you there. Yeah.
Yeah. But it's like helpful, but the word health, woman in the singular. It's everywhere you get podcasts. We drop once a week. It's topics related to pregnancy, women's health, wellness. We have birth stories. It's sort of, we have a wide scope. We have a great audience in terms of like engagement. And then it's obviously the book. And we have websites, healthfulwoman.com. There's a lot of good information there. The podcasts are there. You can Google. I'm around. I'm up and about. You can find me.
I will drop links to all those resources in the show notes to make it easy. And by the way, I'm from Connecticut originally, and I married a Jersey boy. So I'm loving the New York vibes that I got in this whole conversation because I'm really just an East Coast transplant here in Denver.
No, but I'm the opposite. I'm a nice person who moved to New York. Right. So that's my pleasant disposition is the Midwest in me. It's,
That makes sense. That makes so much sense. Well, this has been so delightful. Thank you, Dr. Nathan Fox, for joining us today.
Thank you for having me.
For links to everything Dr. Fox and I just discussed, head to bossedup.org/episode 460. That's bossedup.org/episode 460. We've got the full transcript available and a blog post summarizing the key points that we discussed as well. So it's an easy thing to share. And I've got links to all the great things that Dr. Nate Fox is up to. And thank you for being with me on this journey. It's a very exciting time around here. And I'm so delighted to be navigating even a complex situation. Although after reading Emily and Nate's book, I'm feeling like my complex pregnancy is far from the most kinds of complex pregnancies that are out there. And so I'm just full of gratitude right now. Things are crazy. Things are wild. I'm overwhelmed by a lot. And, navigating all this with a full-time job now is very different in my perspective than as an entrepreneur full time. And so I just appreciate you being along for the ride with me. I'd love to hear from you. As always, let's keep the conversation going in the Bossed Up Courage community on Facebook or in the Bossed Up group on LinkedIn. My inbox is always open at emily@bossedup.org. And until next time, let's keep bossin' in pursuit of our purpose, and together let's lift as we climb.